Hello everyone and welcome back to my channel. If you are new here, my name is Deanna and I make videos about mental health and self-improvement. And in today's video I'm going to be discussing the term and the topic of I'm not unwell enough. And trying to remain so strong. I know it's good if I'm alone. I got it. So as I said, my name is Deanna and I make videos on mental health. I myself have had a lot of mental health struggles in the past. And I have been subject to the whole term, I'm not unwell enough. I'm going to be discussing how this has come into my life and also how it impacts the community of mental health sufferers, and also things that I think might be able to help the term and also help the stigma surrounding some of conditions that are generally affected by the term not unwell enough. So I have had multiple different admissions to hospital. I have presented differently every single time, and I have also experienced on numerous of those admissions, I have experienced a high barrier to entry. And when I say this, I mean that I have actually been physically told by a crisis team member that you are not unwell enough to be admitted to the psych ward. And to be told that when you're feeling like you're suffering so intensely and you feel like your symptoms are never going to get any worse, and then to be told that you're not unwell enough by somebody who's meant to be a professional and meant to be professionally assessing you, it does affect you a lot, because you think, well, I'm not telling you half of it. Do you want me to tell you all of it? And when somebody who is diagnosed with, say for example, borderline personality disorder or emotional unstable personality disorder as is also known, that can come across and the whole manipulation gets brought into it. So that is also, like, it also feeds into the stigma of, well, you're manipulating me, you're trying to get me to, you're trying to manipulate me into admitting you, when actually a lot of people who have borderline personality disorder have unhealed trauma, and because of that unhealed trauma they sometimes say things sometimes that are not necessarily the way they mean them. So let me break that down. So if someone with borderline personality disorder or emotional unstable personality disorder says, well, I'll show you how unwell I am, that is probably a wrong way of saying it. I myself, when I've been unwell, have just said things without really thinking, and I've probably said something along those lines. But in a nutshell, I'm trying to say that I'm unwell, I'm not showing you, I'm not telling you and showing you everything that's happening at the moment, and most of the time I'm not telling you everything that's going on in my illness because of the stigma, because of the judgments that I might face, because of the term attention seeking and manipulation. And so a lot of people who have illnesses, not just borderline, but may also have other conditions, may not be saying everything that is going on in their lives and everything that's making them unwell because they're afraid of the stigma. And that is why stigma is bad. Stigma affects people and service users in general, because they think, well, if I say everything that's going on in my life, I'm gonna get stigmatized for it. But another reason and another way that I think it comes from is more from the fact that the crisis team might say, we can safely manage you at home, but the crisis team are only there for half an hour to 45 minutes of your day. They may not get a true reflection as to how you're exactly feeling, coupled with the fact that you might not be telling them everything because of the stigma that you're afraid of. Those two things together mean that the crisis team probably have a hard job in trying to gauge exactly how that person is feeling. So I myself do not have a positive experience with the crisis team, as I'm sure that probably a lot of you also have never had a good experience with the crisis team. On mental health TikTok, for example, there was or is a trend going around where people say the worst experience they've had with the crisis team, and that is a true reflection, I suppose, of like sometimes what you're told by the crisis team. Like sometimes I think I'm told the same advice every single time, and so I joke sometimes about the crisis team having a little piece of paper by the phone as to like a checklist as to what they can say to you and things like that, because I find that I never really get a conversation with someone from the crisis team. It's a half-hearted conversation where, you know, they're trying to tick off those boxes at the side and they're saying, oh, have you tried having a cup of tea? And, you know, and I'll turn around and say, I don't drink tea. Coffee? I don't drink coffee. Okay, well, have you tried having a bath? And they'll move on to the next one. And I don't actually have a bath in my flat. So I'm like, well, I don't have a bath. And they're like, you don't have a bath? No, I don't have a bath. Oh, have you tried going for a walk? And then being told to go for a walk when it's like 2 in the morning is never practical, especially as a young female. But we shan't go into every single little thing that the crisis team say, because I assume they probably have got a very hard job, and I can't obviously vouch for every single thing that has been said to me. I can only talk from a service user's point of view, and to say that sometimes some of the things I've said have been really, really shitty. I'm not going to lie. Like, one time a crisis team person said to me, can you call back in the morning? And I goes, I don't plan my crisis in. And he goes, well, we haven't got enough staff to come out and see you, or we haven't got enough staff to talk to you at the moment, so can you just call back in the morning? And I was like, no, I can't call back in the morning, because in the morning I might not feel how I'm feeling, and in the morning I can probably just call my normal CMHT. And what annoyed me about that is they're a crisis team. They're supposed to be there as a barrier to stop you from doing anything. They're supposed to be there to, like, help you in these times of need. And to be told that they haven't got enough staff, or to be basically, even if you do get through to somebody, to talk to somebody and then basically to be off the phone within 10 or 15 minutes because they'll say to you, oh, why don't you try and listen to some calming music, or why don't you try and do this and call me back in 30 minutes if you still feel rubbish. And it almost feels like you're being bounced like a ping pong ball. Like, you're kind of feeling rubbish, so you call the crisis team. The crisis team say to you, oh, can you try this? And so you're being bounced back. And the whole term not well enough feeds into this, because you think, well, if I was unwell enough, they would at least talk to me. Or if I was unwell enough, they would come and see me. Or if I was unwell enough, they would, I don't know, give me a different suggestion. And sometimes in crises, you don't necessarily know what you want. You just know that you just don't want the generic advice of have a bath, have a cup of tea, go for a walk. I don't know, mindful colouring's another one, or listen to some mindfulness music. Like, you don't want somebody to just tell you the generic stuff. You want that person to be listening to you, and even if it's just talking about what's making you feel upset and talking to you about what's making you feel distressed. Because for me, if I talk about what's making me feel distressed, I will eventually, in about 45 minutes, I will circle back round to feeling more positive, and then the person on the other end of the phone can actually give me some practical advice that I'll listen to, rather than being annoyed or angry by them just giving me the advice and trying to push me off the phone. For example, when I'm feeling low or I need to talk to somebody and I can't get hold of any of my friends, or I feel like I'm too distressed to burden my friends with, you know, how I'm feeling, I'll call the Samaritans. And I love calling the Samaritans when I need them, mainly because the Samaritans have the time of day to listen to me. And I talk about this in various different videos about time of day, and how most people who have mental health appreciate being given the time of day, and they appreciate being given more than that 5 or 10 minutes. They appreciate the little things more than the big gestures. Like, for example, I've got a video that's going to be coming up very soon about I don't think I've got borderline personality disorder, and reasons why I don't think I've got borderline personality disorder. And in that video I do describe some people who have given me the time of day, who may have only known me once, but have actually spent a bit longer with me and have actually given me that time of day, and how much I've appreciated it. So look out for that video. It's going to be titled something along the lines of I don't think I've got borderline personality disorder, so what have I got? And I'm going to be discussing that topic in one of my future videos. So I want to talk a little bit more about some of the impact that this can have on people who have mental health conditions. So for example, I myself have been denied access to services because I am quote unquote not unwell enough, and I find this just rubbish. Like, I have been denied an admission to hospital solely because of my diagnosis, and a doctor coming in and just saying, I'm not going to admit you, so you can just get that straight in your head. Like, to have that being said to me even before he said what his name is shocking, because the people who are even just human would at least say, hello, my name is. And that is one of the things that actually the NHS strive to do, is to say who they are before they start doing any sort of assessment or treatment. But it conspires that in that particular situation, that doctor had read my notes, had saw borderline personality disorder written on paper, and had gone, right, I'm not going to admit her. And that is why in my future video I am going to be discussing why I don't think I have borderline, but that is for a future video. So I want to talk about the community, and just so putting the crisis team and doctors and NHS and any other health professionals to side, and just talking about the community of mental health conditions. And I myself, being a part of mentally unwell sort of Twitter at the time and things like that, and having the outlet of Twitter when I was younger, I know that there is a certain amount of I'm not unwell enough to ask for help, and that is where the I'm not unwell enough turns to the stigma, and that is where it becomes dangerous. Because somebody like myself, when I've been through the services for sort of 3 or 4 years and I've gone, well, they're just going to tell me to have a cup of tea, or they're just going to tell me to, you know, have a hot bath, I will then turn that round to say I'm not unwell enough to ask for help. I haven't done this yet, so I can't call the people for help because I'm not unwell enough. And that is where it becomes dangerous, because by saying you're not unwell enough, you're never not unwell enough. That is the point I'm trying to get across. You're never not unwell enough. You just need to find the right person who will listen to you, and the right person who will give you that time of day. And I believe that there is somebody, almost like soulmates, but there is somebody, a health professional or a friend or a charity worker or somebody out there that will give you that time of day, that will help you through what you're going through. The whole term not unwell enough, as I said, doesn't just go to the crisis team and, you know, and people and health professionals that are saying you're not unwell enough. It then becomes dangerous when it goes to the whole community side of things, where you say I'm not unwell enough to ask for help. And I know this is a big thing within the eating disorder community, where like they say I'm not thin enough, I'm not unwell enough to ask for help, I'm not a danger yet, so therefore I don't need to ask for help. And what I'm trying to say is your feelings, how you're experiencing them, what you're experiencing is valid. And if you're even so much as, you know, having any sort of behaviours that are causing even a slightest concern, ask for help. Like, you may not get help, and you may go through, you know, multiple different health professionals to get the right person, but you will find that person that will help you. I also find that the competition can be ruthless within the community of, you know, of service users. You can have someone say, I've had 9 admissions to hospital, I've had 6 admissions to hospital, and it's almost like a competition to show how unwell you've been. And I don't know, it just comes across as, for me, I tried not to feed into that, but if somebody said to me, oh, I've had this many admissions, how many have you had? If I was directly asked, I would say how many I've had. But I suppose it's hard to not get competitive with the I'm not unwell enough when you're constantly comparing yourself to somebody who's had more admissions than you, or has, you know, done a worse attempt than you. Like, you just, it becomes dangerous when that happens, because it starts off as I'm not unwell enough and the thought and the stigma relating to it, but that stigma turns into I've got to do more to be unwell enough, and I've got to, you know, for example in the eating disorder community, I've got to lose more weight to be unwell enough, when that is definitely not the case. Like, if you're experiencing symptoms, you need to get help for them, end of. And services are definitely not equipped to deal with the amount of people who would need help if everyone was to ask for help. They say that mental health affects 1 in 4 people, but I actually think it's more like 1 in 2 or 1 in 3, because lots of people don't ask for help, and lots of people will use the whole, well, it's not an issue, I'm not unwell enough. Even if it's as simple as, or not as simple, but even if it's as common as depression, for example. People can get depression, people can get chronic depression, people can get depression that's relating to, I don't know, losing their job, or like losing a loved one, like grief depression, and people will say, but it's not as bad as so and so, or I'm not unwell enough to ask for help. When in actual fact, you're letting yourself suffer, you're letting yourself get worse before you ask for help. And sometimes asking for help earlier will actually allow you to feel better and to not fall down as deep. Like, imagine if you're digging a hole, if you've only dug a hole that is 2 foot deep, that is a lot easier to get out of that hole than it is if it is 12 foot deep. So having that analogy and saying, well, I'm only 2 foot into this depression, I can quite easily jump out of that hole. If it's 12 foot deep or 18 foot deep or 30 foot deep. That is a lot harder to climb out of, and I myself have let that hole get to probably beyond 30 foot deep, and I have slowly but surely climbed out of that hole, and it took me years. I have been under mental health services now for about 10 years, and it has not been a smooth sailing journey. But I'm here to tell you that there is light at the end of the tunnel. And even if you believe that you're not unwell enough, I'm telling you that any sort of unwell is unwell enough. So before I end today's video, I just wanted to talk about a few things that I believe would help the current situation of not unwell enough and the whole stigma behind that. So going back and talking about borderline personality disorder, everyone with borderline personality disorder experiences their symptoms differently, like for every condition in the whole entirety of mental health. You may have someone with schizophrenia who just gets the auditory symptoms, you may have someone who just gets the visual symptoms, and you may have someone who gets both. Similarly with borderline personality disorder, you're going to have different people who have different severity of symptoms and also different amounts of symptoms. I believe there is 8 or 9 different criteria for borderline personality disorder. You're going to have somebody who experiences all 9 and somebody who experiences maybe 7 of those, and it doesn't mean that either one of them they shouldn't all be put in one box. And being put in one box leads to a lot of stigma. And I believe that everyone with borderline personality disorder should at least be assessed first before being judged based on their diagnosis. As I said earlier in this video, I have been judged based solely on my diagnosis, my current diagnosis, which I believe is wrong. I've never believed in me being diagnosed with that condition. And I've been judged based solely on that before I was even assessed, before I even saw this doctor face to face. So I believe that more training needs to be given to those sorts of doctors and those doctors who feel it's okay to just see a diagnosis on their notes and to judge, because by having judgmental doctors, we're never going to get anywhere with mental health. We're really not. The next thing that I feel that would help with the struggle with the I'm not unwell enough is having more specialised units. So rather than having a load of mental health units that are just generalised and they've got everyone in those units, I believe there should be more eating disorder units. There should be more units that treat borderline personality disorder. There should be more units that treat, schizophrenia and hallucinatory disorders. Even if you have a hospital and that hospital has different wards and each ward treats something different, I believe that is going to really help, because then you can actually train the people who are working on those wards to properly treat the patients that are on that ward. For example, if I'd gone to a borderline personality disorder unit, they might have seen that I don't actually have borderline personality disorder and might have been able to identify that I needed a different diagnosis earlier in my journey. But that being said, I believe that less stigma is the way forward, and whatever way that can happen, I'm going to keep making videos until I'm blue in the face about stigma, because the stigma that is surrounding a lot of conditions angers me. Because society stigma is one thing, and you're never going to completely stomp out the society stigma towards mental health. We are getting a lot better in society. TikTok in a way is helping, because it's showing people the reality of depression or the reality of anxiety or whatever condition that person's making a video about. But it angers me more when there's doctors or there's nurses in the profession of caring for people and they feel that it's okay to judge people when they're in that profession, and that's what really angers me. So I feel that we need to have a way of treating our mental health patients with kindness, caring, compassion, and actually having the ability to treat them like that is only going to help the situation. It's not going to hinder it. So that is my things that I think is really going to help the situation. Leave me a comment down below if you think that there is anything else that the NHS or just society in general can do to help the understanding and to alleviate some of the stigma of mental health conditions. I'll be replying and hearting to every single one of you. Please don't forget to hit that subscribe button and like this video so it can be spread to more people. And without further ado, I'm going to end this video here by saying that I believe in you even if nobody else does. And I shall see you in my next one. Bye.
Just like you're young again, no don't you cry, just get back up again.